Is Dr. Bonnie Henry, BC's Provincial Health Officer. We're honored to be here on the territories of the Lekwungen-speaking people of the Esquimalt and the Songhees First Nations. Before I start, I just want to acknowledge the fact that we were late yesterday in presenting our daily data to the media and to the public. I wanted to apologize for that. I know it pushed many members of the media past their deadlines. You'll know that we're going to present the data for today at 3 o'clock. I can tell you that it's going to arrive at 3 o'clock, and we'll address the issues raised yesterday. So with that, I wanted to introduce Dr. Bonnie Henry for our presentation on modeling. I wanted to say that the purpose of that presentation is to update the current epidemiology of COVID-19 in BC, to compare our current state in BC to previous projections that we had made. As you know, we presented our modeling first amongst the provinces on March the 27th, and that brings that up to date. That we're going to do that with respect to cases and ICU status, to provide an update on our health system level of preparedness for those who are critically ill with COVID-19, and to highlight the effect of our public health measures and societal action. And of course, to identify the considerations involving next steps. And with that, I'd like to introduce Dr. Henry.
Thank you very much. It's a great honor for us to be able to present this information and to give the people of British Columbia an idea of where we've been and where we're going with regards to the pandemic of COVID-19 here in BC. So I'm going to start with presenting what we call the epidemiology. So that is the person, place, and time of what has happened of our pandemic in British Columbia. This next slide, and I understand for those of you who want, there's a live streaming at the BC CDC website that will help you, that you can look at this as well. I know the last time we presented there were some challenges in being able to see the slides. But what this slide shows is what we call the epidemic curve. And that, for us in public health, is a depiction of what has happened in British Columbia with COVID-19. So the thick line on the top, the pink line, is what we call the new cases. So this is what we have been reporting every day in British Columbia, the number of new cases of COVID-19 that we've seen. And as you can tell, we've been at this for some time. Our first case in British Columbia was in January, and we had a number of imported cases over January and February. And then in early March, we started to see what we call community transmission. So it was importations that had then started to spread between others. And as we know, here in British Columbia, that often involved outbreaks at long-term care homes, with the first long-term care home outbreak in Lynn Valley in early January. What is also on this slide down below is the measures of our new cases in intensive care unit, and that's in the blue at the bottom, and that is a more stable measure of where we are now in this pandemic. It's the number of people who've required critical care in our system in BC. And also what we've plotted is the yellow line is the number of people who have died from COVID-19 in British Columbia. And of course, that tells us about the impact that this is 54. I'll give some more data on age in a minute. We know that about 53% of the cases so far in British Columbia are female, are women, and this also reflects the fact that we have been testing in our healthcare system, and most of our healthcare work, and I'll show you able to be recover at home. The average or the median age of people who have been in hospital in BC has been 68. Currently, we have about who have been affected. And this again reflects that most young, healthy people have relatively mild illness that is being able to be, that they are able to care and stay at home and recover at home. The average or the median age of people who have been in hospital in BC has been 68. Currently, we have about 58 people, it's a little less than that today, in critical care or in our ICU system. We've had 942 people up until April 14th who have recovered. And so those are people who have recovered at home, have been discharged from hospital, have had their ICU care and recovered, and are now at home as well. We have some limited data on the underlying illnesses that people have, and about a third of people, a little over a third, have had at least one chronic condition. And those numbers go up as we get older, and we have more likely to have illnesses like cancer or diabetes or other things that make you more likely to have more severe illness. As of the 14th, we had 72 people in British Columbia who died from COVID-19. And the median age of those who died, again, is quite a bit older. So we know that it more differentially affects our seniors and elders. And we know that the long-term care facility outbreaks has led to a large number of people who have died from this disease, and their families and their caregivers have all been affected by that. The next slide talks about where geographically we have seen cases, and what you can see is that no region of this province has been spared. We know that there have been outbreaks and there have been cases, there have been imported cases, there's been community transmission in all areas of the province. Having said that, the bulk of the cases are in the Lower Mainland, in the Vancouver Coastal and Fraser Health regions. On the next slide, this gives you an indication of the percentage of our population in different age groups that have been affected by COVID-19 in British Columbia. So the bars on the far right, the pink bars, are the proportion of people in that age group in our population in British Columbia. So we have about a little under 10% of our population is under the age of 10. About 10% are in the 10 to 19 age group. And you can go along and see that. So we have a very small percentage who are over 90. But when we look at the number of people who've been affected by COVID-19, so that's the green bars, that are the second bar in from the right, most of the cases have been people between the ages of 30 and 60. And again, that reflects that we've been doing a lot of testing of our healthcare workers and other essential workers who tend to be in that age group. Those who've required hospitalization, the next bar over, again starts to skew towards the older age group, the older population. And that continues for those who need intensive care. So those are the yellow bars or green bars, depending on which of the graphs you're looking at, the next one over. Most of those people who have been required intensive care and ventilation are people in the 50 to 79 year age group. And finally, the bars on the far right are the deaths that we've had in BC from COVID-19. And we've had one death in a person in their 40s, two people in their 60s, but the majority of them have been people who have been in their 70s, 80s, and 90s, including somebody who was over 100. So this again reflects the tragedy that has been the outbreaks that we've had in our long-term care homes here in British Columbia. In the next slide, this is a little bit more detail around the epidemic curve and what it's telling us about the progression of the pandemic here in British Columbia. So this is the cases reported by the date that their laboratory test came back positive. So this is the information that we've been presenting to you on a daily basis, the new cases that test positive in BC. And what I've put on this slide is also two lines that show when our testing strategy changed. And you will recall that earlier on in March, we started seeing more community transmission and outbreaks in care facilities, and we focused our testing on making sure we were understanding what was happening in our community, picking up outbreaks, and protecting our health system so that we were able to care for everybody who had COVID-19 as well as those who needed care in our system. And the gray hashed area, the gray shaded area, reflects the time that we put in public health measures. So that's when we started to put in those measures that put distance between us as a way to stop the transmission of this virus in our community and in our families. And so that was when we put in the travel restrictions. We put in the social distancing measures. We put in place the suspension of in-classroom schools, the closing of certain businesses where people gather together. And what you can see from this is that that occurred over a period of time, and we still saw cases, quite high levels of cases, over the next number of days. And you may recall my saying that what we were seeing at that time reflected exposures that had happened during the incubation period, so up to 2 weeks prior to that date. And once we got to the 2 weeks from when we put those measures in place, we start to see a gradual decline in the number of new cases. That's our bending the curve. The second line that I put in on April 9th is when we, last week, when we said that now is our time, we have capacity in our system and to be able to start broadening our testing again to make sure that we aren't missing cases and outbreaks and clusters in our community. On our next slide, this is the same graph but presented by the date of onset of illness. So what I have talked about over the last weeks and months has been the work that we do in public health to understand each and every case of this disease. And that means looking at when people's symptoms started. And it is helpful for us to put that on the graph because it helps us understand where and when exposures happened. It also is part of the reflection that we have around contact tracing. So when I know when you started having your symptoms and I know who you've been in contact with, I can isolate those people and make sure that they're not passing it on to anybody else if and when they get sick. So that's what this graph is showing, and I've put in the 2 lines around the laboratory testing strategy so you can equate it to when the test results came back. And what we can see quite clearly is that when we put in these public health measures, we started quite quickly to see a decrease in new cases coming out in British Columbia. The other thing that's reflected on this is where people acquired their illness, for the most part. We don't know for some people, but for most people we're able to plot it. And the bars on the bottom, the dark ones, the blue, that is people who acquired their illness outside of Canada, so from travel. So those are the travel-related cases, and as you can see early on, that's mostly what we had, with some limited transmission, mostly within family units. And then we started to get quite a bit more early on in March, and a lot of that was reflection of travel from the United States, particularly Washington State, when we became aware of the extent of community transmission in Washington. But we continue to see imported cases of disease, and those are ones that we're monitoring very carefully. And one of the reasons why we put in the measures that we did at the borders here in British Columbia and now across Canada to make sure that everybody who comes home to BC is able to join our efforts to make sure we're stopping the transmission of this virus. And that means making sure they have a plan and we can support them in self-isolating so that if they do become ill, they're not going to transmit it to their family or their community here in BC. So the next 4 slides are a presentation, the next 4 slides are showing the graphs of the trajectories that we presented before with the updated data from here in BC. So, and some updated data, of course, from the other jurisdictions that we compared ourselves to a few weeks ago when we presented this. So the first one is the cumulative diagnosed cases in British Columbia compared to a number of international, a number of other international outbreaks. And what this is a rate. So it is the number of cases per million population. And we pulled everybody back because we know things were timed at different times around the world, but we pulled everybody back to day one is when you reached 2 cases per million population. And the reason why BC is a little bit farther out than the rest of Canada is because we hit that marker first. We had the cases that we had here in BC started earlier, and our pandemic started earlier than other parts of Canada. But as you can see, we have flattened that curve. And compared to Canada, we are still at a fairly low but steady rate, and we are much lower than what we see for the United States, for Italy, for Spain, for some of the other countries that have had outbreaks that have followed us in their trajectory. The next slide presents the same information, comparing us to other international outbreaks with the rate of deaths that we're seeing in British Columbia. And I know it's a challenging thing because everybody's outbreak is somewhat different, and ours, of course, has been driven by the tragedy of the deaths in our long-term care homes. But this looks at, next slide, is the same